Good evening, everyone. I'm a second year nursing student, and I'm here to talk about my mental health placement. So, I did my placement in. I'm sorry about my dog. He's just barking for no reason. So, I worked in Marter Hospital Mental Health Unit in Newcastle branch. So there is Newcastle, Lake Macquarie, and different names. And there is like a ICU. There is a ward for the elderly. There used to be a ward for the COVID clients, but at the moment it's pretty much like a normal thing. So I was in the acute wing. So in the acute unit, it was pretty interesting. Um, like you could come to the hospital and present yourself, and you could tell you have like a depression, suicidal issue, whatever you want. You can present yourself and you'll be classified like a voluntary patient. But if somebody in the public reports you and if the police bring you, you could become like an involuntary patient, and the mental health act. Sometimes you could be voluntary, and the doctors would deem that you have some condition and make you an involuntary patient. And yeah, there are different kinds of clients who come in. Some people because of drug abuse, some people have dementia, some people are like threat to the society, some people are suicidal, depression, schizophrenia, whatever. So in because I have a very aged care background, we do end-to-end care like feeding, showering, even repositioning, everything. We do get those kind of clients in mental health, but predominantly in these 2 weeks that I worked, what I saw was people were relatively younger. We did have few older clients, but they were not like bed bound or anything. So the nurses were really nice. They have a handover, like a detailed handover, and there was one nurse who had like a planner for each client, and everyone were like teaching me everything, and even the doctors were friendly. And they have great team spirit. I can see myself work in this ward because a good staff is really important. If the nursing staff are bitchy, they can make your life hell. And pretty much whomever I interacted in this ward, they had great team spirit. No one were pulling anybody down, so which is really important. Yeah, and regarding the clients, different kinds of clients came in, and my personal experience was we had a lady whose hair was really matted. I unmatted because I have curly hair, so I unmatted the whole hair. Like I had to work on each single strand, so I felt like I was working in a salon. But yeah, I got to do that, and I'm a South Indian, so I was able to be I was able to interpret one client to the nursing staff. I just think it is pretty cool. Yeah, I can see myself work here, and I recommend this place, Marter Hospital Mental Health, to any nursing staff who's going for a mental health placement. And you get to learn about different mental health conditions, obviously, different legal, like a mental health act, the legal components of it, because some people who come here could have like a forensic history, and most of the checklist that we use in nursing was all because of the mental health. Some of them were started in the mental health, like observation chart and things like that. So you get to see a lot of forms being used. So a lot of people are getting admitted, a lot of discharges, and the way you care for them is slightly different because it's a lot of restrictive practice. You don't give them everything because they can harm themselves, so it's all restricted. I think you guys should try it. That's it for today. Bye bye.